Oral presentation 5, urinary histamine in patients with varying severity of acute dengue. The authors are Professor G.N. Malavige, Professor G. Oggs, Dr. C. Jivendra, Dr. A. Vijayavikrama, Mr. L. Gomez, Dr. S. D. Mahapatuna, Mr. P. Tilagaraj. The presenting author will be Dr. Tehani Silva.
Good morning. I'm Tehani Silva, and I'm from Center for Dengue Research, University of Diamond. And the topic I'm going to talk about today is urinary histamine in patients with varying severity of acute dengue. Now, dengue is not something new for Australians. It's mostly a born viral infection that affects around 390 million individuals annually worldwide. Dengue can be something mild as a flu-like illness, or it could be something lethal, which can lead to hemorrhagic fever. Endothelial dysfunction, the hallmark of severe dengue, results in increased vascular permeability and vascular leak. From previous research done on dengue virus, it has been discovered that dengue virus directly activates mast cell, which cause the release of mast cell mediators such as histamine and leukotrienes. And animals studies done on mediators have shown that these mediators are responsible for causing the vascular leak in dengue hemorrhagic fever. Histamine, which is a product of mast cells, are also known to be a potent inflammatory mediator, and it causes increased vascular permeability. Now, early study carried out on a small cohort of patients showed that in severe dengue, the urinary histamine levels were higher compared to healthy individuals. And in this study, they did a 24-hour collection of urine. Also, another study done on dengue-infected mice showed that the increased permeability can be reduced when they use antihistamines in a dose-dependent manner. So this study was carried out to have a closer look of how urinary histamine or histamine levels behave in acute dengue, and how kinetics of how it behaves throughout the day and throughout the course of the disease. So in methodology, we recruited patients after doing NS1 antigen testing and antibody testing, and we changed the severity of the disease were classified according to WHO criteria. And there was 4 subsets of patients. The main one was a group of 91 patients who were fever day 4 and less. And we took a morning urine and blood sample. And then we recruited another 37 who were on day 5 and 6. And then apart from this, 32 patients were recruited, where we observed them throughout the stay of the hospital duration, throughout the illness, where we collected every day urine and blood samples in the morning. They were all day 4 and under patients at the point of recruitment. Then another small group, 15 patients, where we took samples morning and evening. They were also belonging to the earlier day 4 and under group. All these patients belong to, was recruited from National Institute of Infectious Disease. Now, urinary histamine levels were measured using an ELISA technique, and we normalized these levels by measuring the urinary creatinine for each and every person, and that is also was an ELISA. Viral loads were measured through using a multiplex real-time PCR. All the analysis were done using GraphPad Prism version 8. Now, results, the behavior of urinary histamine in early and late disease. There was recruited 29 healthy individuals, and when we compared them with DF and DHF, it was there was a significant increase in histamine level in DF and DHF group early on in the disease. When we compared DF, DHF, there wasn't a significant differences between them. When we look at the histamine levels throughout the course of the illness, a reduction in the histamine level was noted from day 3 onwards, but these changes were not significant. When we looked at the diurnal variation, day variation, and it was noted that in both DF and DHF, there was a reduction towards the end of the evening, towards the afternoon. This pattern is also noted in healthy histamine levels in healthy individuals. So we had a look at how the viral loads behave throughout the day, and even though we saw 10 to 20-fold individual difference, the difference was not overall, the difference was not significant. Look at the association between urinary histamine level and the viral loads, and there was no correlation between the two. We wanted to have a look whether the primary and secondary infection has an effect on the histamine level. There wasn't any significant correlation between primary and secondary levels as well. In conclusion, IR data suggests that mast cell activation supports the fact that mast cell activation occurs in dengue, and that histamine plays a role in the pathogenesis in early stages of the disease. Now, my supervisor did a phase 2 clinical trial using a drug called lupatidine, which is antihistamine and PAC receptor blocker. So the main focus was it to be a PAC receptor blocker, which showed that there is a reducing vascular leak in dengue with thrombocytopenia. The question is whether this drug, is it the antihistamine effect that help the changes, whether it contributes for these changes as well, which needs to be looked in a little bit more. I have come to the end of my presentation, and I would like to take this opportunity to thank the founders, National Science Foundation, and also Center of Clinical Research, also staff and patient at IDH Hospital. Thank you.
Thank you, madam. Now it's a time for evaluation. Now it's time for questions and answers. If yes.
Yeah, my question is, it was not clear to me. I mean, whether there's a difference between the histamine level between DF and DHF, and whether it was significant. And do you have actually? Yes.
Between DF and DHF, there wasn't any significant difference, only with the control group.
Right. Okay, then, thank you.
You will read the levels of histamine as well as urine. Sorry. Did you do the blood levels of histamine as well as urine? Only urine? Yes, we wanted both from the the problem is when patient will be DHF, it's going to have low kidney perfusion due to the low blood pressure and things like that. So the histamine levels, histamine may be low in these patients unless you do a KLP in the same ratio. Did you do that? We did the normalizing using the urine. But in a situation like GFR, then many not be too accurate. Right. So if we histamine levels in blood would have been more appropriate. Right. And I think it's used lupatidine as an antihistamine. Why did you select that specifically?
No, because it was because my supervisor was doing the clinical trial of that. So I just linked and said this. It was mainly because of in a PAC antagonist. So we were thinking whether the effect, the final result, being an antihistamine, whether that also contributed.
No, why lupatidine?
No. My supervisor was doing that. That's why I just
Okay, thank you.